Hi, I'm Dr. Malik, urologist and pelvic surgeon. Welcome to my channel where you can learn everything you ever wanted to or maybe didn't want to know about urology. Today I'm reacting to the Kominsky method, which is a Netflix show featuring or starring Michael Douglas, who is an acting coach or a retired acting coach, something like that. I'm reacting to an episode that's titled The Prostate Enlarges. So I'm guessing today we're going to learn a little bit about an enlarged prostate. Make sure if you like my videos, give us a big thumbs up and make sure to subscribe so you don't miss out on my videos that come out every Monday.
Excuse me.
Where are you going?
I'm going to the bathroom.
Again?
Yes, again. Are you counting?
Yeah. You're closing in on double digits.
Oh, I appreciate your concern. I'll dedicate this one to you. So that's it. Now we're trickling. Raindrops keep falling on my head. Do, 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 do. This is the last chance before I put you away.
So this is unfortunately a very common occurrence for men of his age. He's manifesting what's called lower urinary tract symptoms. And so lower urinary tract symptoms can be a number of symptoms. They can fall into categories such as storage symptoms or having difficulty keeping urine in your bladder, like urgency, gotta go, the feeling that you have to rush to the bathroom. Frequency, like going very often, or urgency, urinary incontinence, so having leakage of urine because you have this sudden desire to go and you can't make it to the bathroom in time. They can also be called voiding symptoms, or when you have issues emptying your bladder. So that can be having an intermittent stream like you saw there where it's stop and go, or having to strain to urinate, or feeling like you don't empty your bladder when you go. Also, a number of times people can wake up many times to urinate. So anytime over one, if you're waking up 2 or more times at night, that's considered abnormal. This can be caused by a number of problems, including overactive bladder or benign prostatic hyperplasia or an enlarged prostate. There are tons of things that can contribute to this, but those are the 2 most common causes.
Hey.
Hi, where you been?
Bathroom?
Again?
What's with everybody counting?
I'm not counting, I just noticed.
What's wrong?
Nothing's wrong.
I think something's going on with his prostate.
Excuse me, I'd rather my daughter not discuss my prostate.
Well, it's nothing to be embarrassed about. My ex had all kinds of prostate problems. It's treatable.
Okay, I'm going to say it again. I don't want to discuss my prostate with my child. I don't want to hear about your husband's prostate.
Ex-husband.
Did he have prostate cancer?
Yep. But they took it out. It's fine.
Was he able to?
Oh, yeah. I'm with Viagra.
Okay, I'm walking away.
Going back to the bathroom?
Maybe.
Well, yeah.
Cheers.
What a weird conversation. I wonder why his daughter is talking about erectile dysfunction after prostate cancer. But we'll get back to that. They're alluding to the fact that prostate cancer can be a cause of lower urinary tract symptoms. And that's absolutely true. And I don't blame him for not wanting to talk about his prostate in front of anybody. Most men don't even want to talk to me about it, and I'm their urologist. So I totally get that. Prostate cancer can cause lower urinary tract symptoms, and that is something that we screen for when you come in with lower urinary tract symptoms. Typically, we'll talk about the risks and benefits of the screening, and the screening is essentially a blood test or a prostate-specific antigen test where we check what your level of your PSA is. And that gives us an estimate or risk of having prostate cancer, and if the level is high, we would recommend a prostate biopsy if that was the case. Again, that's not necessarily what happens in the majority of people. The majority of people have, like I said, overactive bladder or benign prostatic hyperplasia. So they did also mention erectile dysfunction after you get treated for prostate cancer. Some of the common side effects you can have are urinary incontinence, which is leakage of urine, or erectile dysfunction. Not necessarily everyone has them, and it really depends on how aggressive your prostate cancer is, what treatment you get, and if you're getting surgery, how much of the nerve they're able to spare. I'm not going to get into all the details of that today, but let's see what else happens in an episode.
Thanks. Thank you for a lovely funeral.
You're welcome.
Can't wait to tell all my friends that Barbara Streisand hit on me.
Don't flatter yourself. He hit on me, too.
So are you staying at Norman's tonight?
No, I'm gonna give him a little space with his daughter.
Good plan. I invite you in, but my son is.
I understand.
Thanks.
Good night. This is complete and utter bullshit.
So unfortunately, I see this all the time. So many people are paralyzed by their urinary symptoms, and they can't go anywhere because they need to know where the nearest bathroom is. They can't go watch a movie. They can't take a long car ride or get on a plane because they're really stressed about how often they have to go to the bathroom. And this is just one example of it. And it's really unfortunate that so many people have to deal with that. But the good news is that we do have treatments that can help. So if you're suffering with these symptoms, please see a urologist.
Dad, you in there?
Yeah.
We've got a racially charged situation happening in class. Are you gonna be long?
I don't know.
Want some coffee?
No, it just makes me pee.
Well, it's a diuretic.
You wouldn't happen to have a urologist that you like?
Like? No one likes their urologist, but I do have a good one.
I need his number.
I already gave it to Mindy. She's gonna make you an appointment.
Jesus, everything in my pants is public knowledge.
I'm just glad you're not in denial anymore.
Norman, yesterday I kissed a woman goodnight and then urinated on her bush.
I'm sorry?
The bush outside her house.
Ah. Yeah, that's a slow dripping cry for help.
Dad?
Well, I'm glad he's finally seeing a urologist. So they did mention coffee, and coffee is not only a diuretic, but it's a bladder irritant. If you want to learn more about bladder irritants, make sure you check out my video on bladder irritants. And I talk about coffee and a number of other bladder irritants like alcohol, spicy foods, acidic foods, artificial sweeteners, and why they cause our bladder to be more sensitive and how you can limit those to help your bladder symptoms. So make sure you check that out. I also resent that he said no one likes their urologist. I happen to think a lot of my patients like me, and urologists are genuinely pretty nice people. I mean, there's the occasional interesting character, but for the most part, I think we're very likable, very nice people. As you can see, I have a whole series called Urologist Answer, where I interview some of my favorite urologists and friends who talk about their experiences as urologists, and you can see that they all seem like pretty normal, nice, likable people.
And fill these out, and the doctor will see you shortly.
Thank you. Just so you know, I'm here for penis reduction surgery.
Okay,
Been getting some complaints lately.
got it.
Jesus Christ.
The sad part is, That water cooler has a better flow than I do.
How often do you have to come here?
Not cool, man. Not cool.
So you might think you're the only one who gets the urge to go when you hear water running or when you get to the door, but it's so common. It's called keyhole urgency. There's actually a term for it because people do generally put the key in the door and get the urge to rush to the bathroom. And definitely running or dripping water can cause that urge to come and make you feel like you gotta go. I really didn't get that whole thing where the guy got mad at him for asking how often he has to come here, but maybe I'm just missing something. I think it's a pretty reasonable question. I think he was just nervous, but maybe I'm missing something there that's not okay with the bro code or something. And in the beginning of that scene, he talks about penis reduction. So that's not a thing. People don't actually come in for penis reduction. So number one, I don't really get patients coming in trying to show off and overcompensate like that in my clinic, or I don't think in most urology clinics. But also, again, penis reduction is not a thing. If you're wondering about the average penile length, check out my video on this where I react to scrubs and talk about the average penile length and what exactly that is.
Oh, there's nothing else going on besides the frequent urination.
No. I mean, I have had a little bronchial irritation, but that's kind of out of your purview, isn't it?
Yeah. Anyway, we're going to do some tests and make sure there's nothing serious going on.
What do you mean by serious?
Cancer.
All right.
But based on your symptoms, I would say we're dealing with prostatic hyperplasia.
Which means?
You got a big prostate.
Which means?
You're going to pee a lot.
Can you tell me something I don't know?
I got to second base with my nurse last night. That's an old joke, but I did.
Congratulations. What about my prostate?
Well, we have options. There's drugs, and there's transurethral resection.
And what's involved with that?
I drill through your penis and core out your prostate like a Roto-Rooter.
Oh, my God.
Yeah, it's an exciting time to be a urologist. But let's not get ahead of ourselves. Drop your drawers, lay on your side over there. I'll poke around in there and see what we got.
You keep saying we.
You complete me.
I gotta ask, when you were a young guy in med school, what made you decide to become a urologist?
I get asked that a lot.
And the answer is?
Variety. Dicks are like snowflakes. There's no two alike. Say ah.
Ah!
Dicks are like snowflakes. That's not one I've used before, but definitely there is a lot of variety in urology. So this urologist is a little bit flippant and not the best explainer or educator about BPH. So let me try to fill the gap here. So BPH, or benign prostatic hyperplasia, is a disease where the prostate cells themselves actually get larger over time and cause nodules in the prostate. And then this actually obstructs the flow of urine going down the urethra from the bladder, making it hard to urinate. And when you have an obstruction, this can cause those storage symptoms we talked about: urgency, frequency, nocturia, or having incontinence. It can also cause those voiding symptoms we talked about, which is slow stream or intermittent stream or things like that. BPH is extremely common. In the United States alone, men aged 60 to 69, about 70% of them will have BPH. And when you go above 70, that number increases to 80%. But that doesn't mean that all patients will have symptoms. So when you come to the doctor with symptoms of BPH or any lower urinary tract symptoms, you'll have a number of tests, pretty standard. So you'll get a urinalysis to rule out infection. You'll get a digital rectal exam, as he's about to do or doing, to assess the size of the prostate and assess for any nodules or abnormalities that could be concerning for cancer. You'll also get a PSA blood test, as we mentioned earlier. earlier to check for prostate cancer. You can also get a Uroflow where they have you urinate on top of this dish that measures how fast your flow is to see how fast or slow your flow is when you urinate. And sometimes you may get a bladder scan to see how well you're emptying. So that's a small ultrasound that you just put on the lower part of the belly that tells us how much urine you have left in your bladder when you're all done. And all these tests help give us some information that help us make the diagnosis of what's causing your lower urinary tract symptoms. So as far as treatment, he goes through this really quickly, but for conservative management, you would do things similar like you would do for overactive bladder. So if you want to know what those things are, you can check out my video on 5 easy things you can do to reduce your overactive bladder symptoms, because the conservative treatment for OAB and BPH are very similar. As far as medications, you can take alpha blocker medications like tamsulosin, or some of you may have heard of the term Flomax, that can help actually relax the smooth muscle in the urethra, which allows urine to pass a little bit better. Or you can take medications like finasteride, which actually reduce the size of the prostate. However, these take about 6 to 9 months to take effect. If these medications don't work, or you don't want to take medications, or you have other reasons like recurrent infections or problems with your kidney or things of that nature, then we would discuss surgical options. And there are many, many surgical options, some that we can do simply in the office with just a local anesthetic, or some that require more anesthesia and a little bit more involvement. But what he's talking about is transurethral resection of the prostate. There is no drilling of the penis at all. What we do is we take a camera and we go inside the urethra when you're asleep and we scrape out the prostate. This is usually done with a general anesthetic or a spinal anesthetic so that you don't feel any of the procedure when it's being done. Either you can go home the same day or spend 1 night in the hospital, and typically you'll have a catheter for at least 1 night after the procedure is done to make sure that you allow the area to heal and that there's no extensive bleeding after the procedure. This is one of the most common surgeries done for prostate. Nowadays, we have lots of options in addition to the TURP for enlarged prostates, including prostatic urethral lift. We have water vapor therapy, aqua ablation, laser vaporization of the prostate, and laser enucleation of the prostate. So there are many, many options. So when you see a urologist, if you're having issues, you can talk about all the options, what are the risks and benefits, and what you're looking for specifically in your treatment outcomes.
Now bear down on me. That's it. Bear down. Because I gotta, come on, push, 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 push. You know, the funny thing is, even gay guys don't like this.
That's hilarious.
Push, push, push. I gotta touch it. Push, I gotta feel it with my finger. Put, there you go. That's it. That's, ooh. Oh, that's a big old prostate.
Any chance that my ass is just shrinking?
That's a good one. I'm gonna use that. Here. Here, wipe.
What, no spooning?
That one I heard before.
Now what?
Now we'll check your PSA test, see if you got any cancer.
How long does that take?
A couple of days.
And if there is?
We do a biopsy and see if it's snail, turtle, or rabbit.
What?
Well, snail, slow moving, no worries. Turtle, a little faster, some worries. Rabbit?
Floppy ears and adorable?
Sure.
I will say that prostate exam was a little bit over-exaggerated. While it's not a comfortable thing, it typically is not so aggressive and doesn't need to be that aggressive. Typically, you can feel the prostate pretty easily without having to have the patient bear down a ton. Also, he does talk about prostate cancer. He gives kind of a nice analogy with the varieties of different types of cancer that can be slow growing or fast growing. But essentially what we look for when we do a biopsy is what's called a Gleason grade, and that tells us how aggressive the cancer is or what kind of low risk, intermediate risk, or high risk type the cancer is. It helps us kind of classify the cancer into one of those categories. But generally speaking, I would say that his discussion was pretty short and brief, and typically when we're talking about screening for prostate cancer, it's a little bit more involved because there are risks and benefits to even screening itself, because there are sometimes false positives on the screening test, which then results in biopsies. So typically we talk about your life expectancy. If you are found to have an elevated PSA, would you want to go on to have a prostate biopsy or not? And it's a little bit more of an involved discussion than, hey, we're just going to check your PSA. But regardless, it is something that we typically recommend doing, especially if you have any sort of urinary symptoms.
So, my darling, how was your day?
I had a strange little man stick his finger up my ass.
Oh, I envy you.
How long is Phoebe staying?
I didn't ask. I find everything with Phoebe is easier if I don't ask.
The willful pursuit of ignorance. Smart.
Any news on the prostate front?
No, just trying to stay cool, waiting for the results of the blood test.
Is eating spicy food your way of thumbing your nose at the specter of death?
You are very wise.
I am a fountain. Drink from me.
We will be punished for eating so late.
2 Tums and a Prilosec before bedtime and a thin pillow under your shoulders to elevate your upper torso while sleeping.
Really?
Drink from me.
So I don't envy this guy. Being a patient and waiting for results can be extremely nerve-wracking. And I apologize for all of us physicians who sometimes don't get back to you as soon as we possibly can, because we're taking care of a lot of things with a lot of different patients. But we really do want to get you those results as soon as possible, because we realize how much anxiety there is waiting for things like that. I am really curious to find out what actually happens and what his test results show and how his symptoms improve. So maybe I'll have to watch some more of this episode. But that's all for today. So thanks so much for joining me today. I hope you enjoyed this episode. Let me know what you thought in the comments, and let me know if there's anything else you want me to react to. And as always, please remember to take care of yourself, because you're worth it.